Argueta. I'm the Communications Director at Unidos, Minnesota. And we are here meeting with a number of healthcare frontline workers as well as people that work here directly at HCMC. We're going to be talking about an incident that occurred on towards the end of the year, around the holidays. And to start us off and talk about what happened, we're going to have Representative Noor, who was on the scene outside that day.
Good afternoon. My name is Mahmoud Noor. I represent District 60B. So on that day, an individual who had medical conditions was taken from the community and then brought directly into the emergency room because of the condition that he was in. When someone of that status is grabbed by ICE, and that leads to a very serious situation. The ICE agents, 6 of them, were involved in that process. They came inside the ED, they handcuffed the individual to the bed, that he was getting access to care, and that meant that he was distressed even further. So that created more harm than necessary. That created tension within the emergency room and within the hospital area. That created tension for the patients who were getting care in the hospital, for everyone who was within that area. Thereafter, that individual was admitted in the hospital. He was handcuffed, and we had some elected officials from Hennepin County who got involved in the process, brought their legal team and everyone else, the administrators, to make sure that those individuals who were rotating 2 agents every 4 hours to make sure that that individual is detained. Given that this is an individual with a high medical risk, that individual, if he was detained, he could have lost his life. So what we're talking about is respecting the rights of the individuals who are critical ill, those who are seeking services in this hospital, when they need those services, regardless of who you are. If you need care, you should not be deterred because of ICE. This is a critical issue. It's about life and death. And this situation would have been really tragic if that individual didn't get the care that they needed in this hospital. So thank you.
Next up, we will have a representative from the Minnesota Nurses Association. She is a healthcare worker, Lex, and I'll have her introduce herself.
Good afternoon. My name is Lex Martin. I'm a registered nurse here at HCMC and a member of the Minnesota Nurses Association. Many of my colleagues and I condemn the lack of regard for patient safety and staff transparency in this situation. In light of these recent events in our hospital, we're asking Hennepin Healthcare to take immediate action to update and enforce our institution's policies regarding interactions with immigration enforcement. First and foremost, immigration officers should not be permitted under any circumstances in private clinical areas without a signed judicial warrant. Absent a complete and correct warrant, immigration officers should be accompanied immediately out of the facility by HHS security. Any action less than this violates patient safety laws, including HIPAA. Should immigration officers possess such a warrant, the security department must diligently verify the identity of officers entering HCMC. With the exception of medical masks, we ask that HCMC enforce a policy of barring face coverings for law enforcement. Security must also carefully document these encounters, including officers' names, their badge numbers, the agencies they represent, the location on HHS property, and the times in and out of the facility. This documentation is consistent with our current written policy regarding interactions with law enforcement. That said, these interactions are not the same as others. In circumstances of detention by ICE, these persons are under administrative custody and not criminals. At present, our hospital policies do not differentiate these very different scenarios. They must be separate. It is cruel and it is unjust to apply policies and measures designed for those held on criminal charges to those who are not. As nurses at Hennepin Healthcare, our primary mission is to provide safe and excellent care to all patients and families, irrespective of their immigration status, their language, or their country of origin. When faced with situations that impede our ability to deliver care, we rely on the institution to provide clear directives as to how to respond. We implore HCMC to step up and implement policies that protect the safety and privacy for all our
information will be emailed afterwards with the same media list. We do have, in addition to the list, we have a representative from the American Pediatrics Association who will be introducing herself as well as Jana.
Hi there, my name is Dr. Jana O'Brien. I am the president-elect of the Minnesota chapter of the American Academy of Pediatrics. We are here for the kids. Over the last several weeks, I have been working with babies who are newborn up until age 18 to 21, and I will tell you that there is a crisis among our Latina and Somali families. They are afraid to come into the hospital. We are seeing a rash of appendicitis that should have been treated earlier, but people have been delaying care because of fear that ICE is going to show up at the hospital. Families are, I'm going to say that again, families are afraid to come in to get life-saving necessary treatment.
That's right.
Because there is a sense of fear that has been perpetuated by our administration, and that we need hospitals to step up. We need institutions to step up. We need our city, and we need our state to protect hospitals and healthcare settings and keep them safe spaces for healing, not places of fear. Being in a hospital is already traumatic enough. Having fear and a sense that they are unsafe or that their family members will be detained is completely unacceptable. We're here for the kids, we're here for everybody of all ages, and we're here for life in Hennepin. Let's stand by what we believe in.
Can you spell your name really quick?
Yes, it is Jana, Janna, last name Gewertz O'Brien, DEWIRTZ-OBRIEN. Thank you.
Next up, we have an elected champion who is continually working on immigration and a good number of issues here in the state of Minnesota. Representative Leash Kozlowski.
Woo! Yeah. Hey everybody, Leash Kozlowski. I use they, them pronouns. I represent the beautiful district of 8B, Duluth in Greater Minnesota, and I'm also here as the co-chair of the Minnesota Posse Caucus as well. And I'm here, and you might wonder why Duluthian is here, is because this is not isolated to the Twin Cities, to HCMC. We know from Duluth and Superior to Brainerd to Worthington to right here that our communities are under siege. And what is happening in a moment of intensified federal immigration enforcement across Minnesota, as we have seen an influx of hundreds of officers being deployed, and that scale matters, and that scale is increasingly adding fear and brutalizing our communities, and as we heard, preventing these places from being healing spaces that are vitally needed for our communities. Communities of color, immigrants, and refugees across the state need these places to remain safe spaces of healing. And we know that our collective resistance to ICE, to this immigration, the violent attack on our communities must go beyond community-led responses. And I am so grateful to be here with healthcare workers who are organizing, union leaders. We've been working with elected officials across all levels, and we need us to step up and step in to make policy solutions that go well beyond just grassroots community solutions and reinforce what the community is doing. So today we're here calling on HCMC as well as Minnesota hospital and healthcare providers to make the same brave choices that have been made in places like California and Illinois when ICE came showing up in their hospitals. They chose to protect patients as well as to protect their healthcare workers. So why this affects people beyond one hospital? Because when enforcement expands, we know that fear spreads. People, as we've heard, are delaying medical care, pulling kids out of school, avoiding workplaces, and disengaging from daily life. We know that the harm does not stop at immigrant families, that it affects public health, worker safety, education, and community stability statewide. And that's why preparation cannot be reactive. And there are steps and measures that we can take right now. Institutions must remember that any ICE presence in your facility, as was stated, puts community and patients at risk. And patients in ICE detention are under civil detention, not criminal custody, and must be treated accordingly. Our community members, when they come here with threat of ICE or are detained, you have to remember are very vulnerable, might not have access to interpretation, might not access daily living necessities, or legal services. And so we're calling on you now to do the right thing before more wrongs are done to our communities. I want to make sure that folks know within the Fourth Amendment frame that every single person, no matter your status, has certain rights imbued upon you by this Constitution that follow you even into the halls of these hospitals. It protects us all from illegal search and seizure. That means mass federal agents do not have the right to enter these institutions without that signed judicial warrant. That protection applies to hospitals, schools, care facilities, businesses, faith communities, and workplaces. And so our institutions must do more now. Do not allow ICE on your premises without a valid signed judicial warrant. Train staff.
No warrant, no ICE.
This. They want to know your rights and responsibilities during search and seizure operations. And put clear policies in place so frontline workers are not left making impossible decisions under pressure. So HCMC, so all of our hospital leaders, you can follow the lead of our communities of brave workers and electeds across the country. Make sure that care is protected here at HCMC in the suburbs of Greater Minnesota. We can do this, and we're counting on you.
Thank you, Representative. Next up, we have representing St. Paul Federation of Educators, Leah Van Dasser.
Yes, I am Leah Van Dasser, President of the St. Paul Federation of Educators. HCMC, the staff is working to get a safety protocol in place. What happened here recently shows why. Every hospital needs a protocol for ICE. Every single workplace, every business, and every corporation, every institution needs a protocol to protect the constitutional rights of employees and patrons. The federal government is conducting illegal searches and seizures, and we need to be prepared. St. Paul educators have worked with St. Paul Public Schools around a protocol already. We've actually provided our members with that protocol right on a badge that goes right with their ID. They have it at their fingertips if needed at crisis. This is not just a theory about a policy, it's a reality that we live in now. Protecting constitutional rights is not the job of any one community. It is the responsibility of every institution that serves the public. What we do now will determine if Minnesota can remain a place where people can live, work, learn, and seek care without fear. Thank you.
Our final speaker is a healthcare worker here from HCMC. We have
not from HCMC.
that does represent our Unidos Minnesota Healthcare Committee, Jamie Sharp.
I'm going to address the audience first. We're so sorry our loudspeaker didn't work today, but I'm going to project, and there's some of this where I'm going to turn around and talk to you because you're my audience for a lot of this, okay? Yeah. Woo. I'm here today as a healthcare worker and an organizer. What happened at HCMC is not abstract to us. It affects how safe our patients feel and how safely we can do our jobs. However, I'm lucky today because I get to talk about the hopeful part of this story. I get to talk about what it means to be a community member. I get to talk about what it means to not only be a healthcare worker, but what it means to be a healer. And we have a crowd of healers behind right here. Yes. Woo! Healers are not robots meant to carry out the orders of their superiors in the service of an inequitable healthcare system. Healers show up for their patients first. Healers show up for their community first. Healers and their communities are inseparable. One massive, beautiful relationship that cannot be touched. When ICE enters a hospital without clear protocols, it puts patients and healers in an impossible situation. The only reason why this story has a safe, successful resolution is because frontline healers took it upon themselves to train outside of work to further protect their patients and their community. They learn their own rights, and most importantly, they learn their patients' rights. These healers knew that successful care relies on trust. They knew that when patients fear arrest or questionings, they delay care or avoid it altogether. That makes conditions worse for everyone in the city. It increases emergencies and harms public health. When these incredible healers who had trained ahead of time without the support of their hospital saw what was happening, they sounded the alarm, which gave all the people behind me the information they needed to stand for accountability and freedom and resolve this incident successfully. In the last 8 months, Unidos Minnesota has trained over 300 frontline healers on specifically what to do if ICE enters the hospital or the clinic. Together, we have brainstormed responses, researched our legal obligations, and have most importantly created a network, a web of healers that work together when a patient, a community member, needs help. Our web, our connection to each other, is ultimately what enabled our response to remove ICE from their unlawful occupation of this facility.
Yes.
This is an invitation to the healthcare workers across Minnesota. Get trained, get organized, and protect your patients. The Unidos Healthcare Committee is hosting our next healthcare worker training on January 18th. These trainings give staff the tools to protect patient rights. You can find the sign up on the Unidos MN Instagram page. Come be a part of our network, our family, our community. This organizing is not limited to hospitals. Workers in other industries and employers are also stepping up to defend constitutional rights in their workplaces. When institutions put clear practices in place, workers are protected and communities are safer. Please attend our event through Monarca, Minnesota, January 14th to organize in all of our workplaces. The website is monarcamn.org. The closing is the most important part. I've saved the most important part for last. I want to speak to our patients, the reason why all of us are here. Can we get all the Latino press to the front? ¿Dónde está la prensa latina? ¿Hay alguien aquí? Sí, perfecto.
Ricardo.
Y si soy un gringo, pero yo puedo hablar español también. There are many more communities than the Latino community that are affected by what we are talking about today. But I only speak Spanish and English. Whether you are Latino, Hmong, Somali, Native, or any of my other neighbors in Minneapolis, I'm speaking to you too. I want to be very clear. La salud es un derecho importante. No podemos entregar nuestra salud para el miedo. Healthcare as a right that we cannot sacrifice. Si tiene dolor, if you are in pain, si está enferma, if you are sick, por favor, vaya al hospital. Please go to the hospital. Si su familia o niños tiene una cita o tiene que recibir vacunas, if your kids or family need to go to the clinic or need vaccines, por favor, vaya a la clínica. Please go to the clinic. Si usted tenga miedo, if you feel unsafe, por favor, llama la comunidad, sus políticos o organizaciones como nosotros. Please reach out to community, your politicians, or organizations like us. La comunidad está presente. Estamos arreglando estos sistemas. The community is here. We are fixing these systems. Nosotros vamos a continuar a ser presentes para asegurar que se queden los hospitales lugares de sanar. Healers will keep showing up to make sure hospitals remain places of healing and not fear. Thank you.